Now, third one, another most important is ALP, that is alkaline phosphatase. Okay, alkaline phosphatase. It has got around 6 isoenzymes. Okay, it has got around 6 isoenzymes, and ALP is a monomer. There are no combinations. It's a monomeric enzyme. It's a monomer enzyme, single enzyme. But what is different in each isoenzyme is the concentration of carbohydrate in the protein. Okay, amount of carbohydrate in the protein is different in different isoenzymes. 6 isoenzymes differ only in the percentage of concentration. Okay, now we'll see what are the 6 different isoenzymes. This itself can be a 5-mark question or 3-mark question. Isoenzymes of the ALP. So first one, that is alpha alkaline phosphatase. So alpha alkaline phosphatase, it is synthesized from biliary canaliculi. Okay, when you see the gallbladder, the major ALP which is inside by the gallbladder, okay, biliary epithelial or canaliculi, it is synthesizing epithelial cells will synthesize this type of isoenzyme, ALP, alpha ALP. It constitutes somewhere around 10% of total ALP. Like say about it was 100% of ALP. In that, 10% is contributed by the gallbladder or biliary canaliculi, that is the epithelial cell. When you see elevation, like for example, you have got obstructive kind of jaundice where stone is formed in the gallbladder. Now, when gallbladder is eroded by this stone, this ALP will elevated. Okay, in obstructive jaundice, this type, that is alpha ALP, is elevated in the blood. So that is about the first one. Second one is alpha 2 heat labile. Heat labile means they are unstable for the heat. If you give the heat, they'll be destroyed. They are stable up to 56 degrees Celsius. If you increase the temperature, say about 65 degrees Celsius, the protein get inactivated. The enzyme get inactivated. They are heat labile, not they are sensitive to the heat. Majorly, they are produced by liver cells or hepatic cells. How much is the concentration? Major portion, 25% of total. So whenever there is liver damage or hepatitis or some kind of infection to the liver, the type of ALP which is elevated is the alpha 2 heat labile. Alpha 2 heat labile type of isoenzymes. Okay, this is about B. Now C, there is type of alpha 2 heat stable. Means if you give this temperature, that is 65 degrees Celsius, still enzyme is active. Okay, still the enzyme is active and they are functional. So this is majorly seen in the what you call similar to the placental isoenzyme. Okay, placental isoenzyme. So this is 3 what we have seen. Next, D, that is also called as pre-beta ALP. Pre-beta ALP. Now this type, it originates from bones. Okay, the ALP, alkaline phosphatase, because in formation of bones, you might have read about 2 enzymes which play a major role in mineralization and demineralization. That is acid phosphatase and alkaline phosphatase. It will create an environment in the bone tissue where it can become acidic environment or basic environment, alkaline environment. Alkaline environment given by alkaline phosphatase, acidic environment is given by acid phosphatase. So bone tissue synthesis ALP, what type it is pre-beta. So if there is bone disease, okay, if there is a bone disease, the pre-beta type will be elevated. Okay, pre-beta type will be elevated. What is the normal concentration of total? 50% of the total ALP is pre-beta type. Means major portion which is present in the blood is majorly from this origin, bone origin. Next, E type, that is the gamma ALP. Okay, why they are called alpha, gamma, beta, I'll tell you next. Okay, next one is gamma ALP, which is originated from intestinal tissue or intestinal cells. So whenever there is some disorders of intestine, like say about ulcerative colitis. Okay, say about ulcerative colitis, because it is a disease of intestine. The intestine contains lot of this kind of ALP. When there is damage to the epithelial cells of intestine, it gets leaked into the blood, and the concentration of this isoenzyme will get elevated. That is elevated. Normally, it is only 10% of total ALP. Whenever there is damage, it will increase more than 10%. Now, last type, there is ALP present in leukocytes. Okay, leukocytes, ALP or alkaline phosphatase. So whenever there is disease of leukocytes, say about you can have the say about CML, chronic myeloid leukemia, the cancerous condition of the leukocytes. The concentration of ALP decreases. If the person is having lymphomas, okay, then the concentration of this type of isoenzyme, leukocyte derived ALP, will be elevated. So these are the 6 different types of ALP. What are they? Alpha ALP, that is also called as alpha 1, alpha 2 heat labile, alpha 2 heat stable. Next, pre-beta and gamma ALP. Last one is leukocyte derived ALP. So these are the 6 different types of isoenzyme. And there is also one more type called as Reagan isoenzyme. In some particular cancerous condition, okay, in particular cancerous condition, like say about cancer of lung or liver or GI tract, there is elevation in a type of called as placental type of ALP. When it is elevated, when there is cancer of this tissue, when there is cancer of this tissue, there is elevation in type of isoenzyme, which is called as placental form. And this kind of isoenzyme we call as Reagan's isoenzyme. Normally, it is not seen. In adults, you don't see placental type of ALP. In adults, if you see placental type of isoenzyme, which we call as Reagan's isoenzyme, it should dictate you that there is some cancer which is going inside the body. Specifically, it can be from the lung tissue, liver tissue, or gut, GI tract. So this is called as Reagan's isoenzyme, or also called as carcinoplacental isoenzyme. Okay, what is called as carcinoplacental isoenzyme. So these are the different types of isoenzymes of ALP, and also a special note on Reagan's isoenzyme. So if I tell you again how they are differentiated ALP is based on electrophoretic pattern, whichever runs near to the positive node, we call alpha, like proteins we have seen, alpha, beta, and gamma portion. So alpha, you can have alpha 1 ALP, alpha 2, you have 2 different types, alpha 2 heat stable and alpha 2 heat labile. Say this is beta, but this isoenzyme is just before the beta, pre-beta. Okay, pre-beta isoenzyme, and there is gamma isoenzyme. Okay, gamma ALP. And other last type is LAP, leukocyte derived alkaline phosphatase. So this is about the alkaline phosphatase, which is a major exam question. And also note on Reagan isoenzyme is a 3-mark question. It is also called as the carcinoplacental isoenzyme. Between all these things, this is elevated only in cancer. Okay, in cancer, you identify type of ALP is Reagan's isoenzyme. Others, it can be disease or disorder of particular tissue. Okay, all 6 isoenzymes. So that is about the ALP. So this we conclude with the topic isoenzyme. So to summarize, isoenzymes are the what you call the same enzyme or multiple form of enzyme which takes part in same type of reaction. They are physically different, chemically different, then electrophoretically different, chromatographically different, immunologically different. Apart from this, they are also differing in Km value, that is Michaelis constant value. They are differing in the maximum velocity what they can achieve, susceptibility towards inhibitors, and also they differ in their degree of denaturation. Okay, and they are also specifically to tell they are synthesized from different tissue or different cells. In the cell, they are synthesized or coded by different genes. So that is about isoenzymes. Examples for the isoenzyme, majorly lactate dehydrogenase, alkaline phosphatase, creatine kinase, and alcohol dehydrogenase. Okay, alcohol dehydrogenase. LDH has got 5 different types of isoenzymes. ALP has got 6 different types of isoenzymes. CK has got 3 isoenzymes. Yes. And alcohol dehydrogenase has got 2 isoenzymes. Yes. How many subunits do LDH has? Which is HH, HH2, all 4 M subunits. Yes. So 5 isoenzymes from 4 subunits. ALP, it is only 1. It differs only in percentage of carbohydrate which is present in the structure. CK has got how many subunits? 2 subunits. Either they are made up of M or B. It's a combination of M and B. ADH, it contains alpha and beta. They're either alpha beta 1 or alpha beta 2. So this is about the isoenzymes. And also you should know their significance. Okay, their significance. Like we have discussed in myocardial infarction, what is the pattern of LDH? What is the pattern of CK, creatine kinase? And alcohol consumption, ADH, Then alkaline phosphate in various like obstructive jaundice, what type of isoenzyme is elevated? If it is say about the liver, leukocyte cancers, lymphoma or CML, what is the pattern? And what is Reagan's isoenzyme? So that all are the subparts of the alkaline phosphatase. Okay. So is it clear with the isoenzymes for today? Yes. So lastly, what you can expect, as I already told in the university questions, long essay, they can ask you define isoenzymes. So you should write what is an isoenzyme and characteristics, and describe different types of isoenzymes. So when long essay, like 15-mark question is there, you should write at least 3. What are LDH, CK, and ALP, isoenzymes of all these 3. Or sometimes in specifically for 5 marks, they might ask you, write a note on isoenzymes of LDH. So you should describe what is LDH, what type of reaction takes place, then what are the subunits, what is the origin of subunits, and how they are different in tissues, and what is the significance, like what disease you can identify by using these subunits. Same way, write a note on isoenzyme creatine kinase, or also called as CPK, creatine phosphokinase. So again, you should write what type of reaction it is involved in, how many subunits are there, what are the different 3 isoenzymes, which tissue is originating from, and what diseases it can help in the diagnosis of the disease or disorder of the tissue. And last, note on Reagan's isoenzyme, which is nothing but related to alkaline phosphatase. Okay, alkaline phosphatase. Majorly it is seen in cancerous condition. Okay, that is cancerous condition. Elevation in. Secondly, it is seen in adults, most commonly in adults. You see placental origin of isoenzyme. Normally in adults, there is no placenta. Definitely this kind of ALP should not come into the tissue or in the blood. If you see placental origin of ALP, then it is nothing but the Reagan's isoenzyme, which is the carcinoplacental type of isoenzyme. Okay, so this is about the isoenzymes for today. Fine. Is it clear for today? Yes, very good. So tomorrow's class, we'll be discussing about the last portion, which is about the